The United Kingdom is Dr. Veer Pushpak Gupta, a physician with the National Health Service. He's also involved in research for recovery trial in the United Kingdom. He's a member of the Royal Society of Medicine as well. Also joining us, Anil Kumar, principal of DPS Faridabad, because the emphasis really is on how fast and how soon schools can be reopened now, given that the number of cases have reduced significantly across the country. Dr. P.S. Narang, Associate Director of the Pediatrics Care Unit of Max Healthcare, is also with us at this point. But Dr. Veer Pushpak, let me come to you first, because the United Kingdom has actually experienced a third COVID wave already, and the kind of impact it can have on children when schools are completely open. This is, we had school children in UK going back to classrooms as early as March, and then in the middle of July, the United Kingdom saw this sharp rise in COVID cases. So tell us a little about the UK experience with children in the third COVID wave.
Yes, thank you for having me on the show, Ankita. I think the UK experience has largely been what Dr. Mishra talked about. I think globally, we've seen an impact that has been less on children with COVID, especially in terms of escalated disease. So I'll give you an example. Out of 6,300 children that got COVID between January of 2021 and now, only 250 have required ICU admission to the pediatric ICU. And the death rate at the moment amongst children in the United Kingdom with COVID is 2 in 1 million. And the death rate obviously goes up with children that have comorbidities such as type 1 diabetes and asthma. But otherwise, generally, children have remained unaffected in terms of escalation of disease and serious disease. And I think that has played a huge impact in the policy making in terms of how we're going to open up schools. So initially, when schools were opened up in March, we were doing daily testing of the senior staff. We were doing lateral flow testing, which is basically a small kit that you can use, do a swab and check whether it is a positive or negative. Now, the sensitivity and specificity of that test is still up for debate, but at least it was giving us some sort of idea of what the infection rate in the schools are. Also, there was a COVID trace app, track and trace app, which was being used to see if any contacts amongst the children are being positive. And if they were, then the children were being told to self-isolate. Now, that was a huge issue because a lot of children were being told to self-isolate, and in return, parents had to self-isolate. So it was a huge issue for the economic setup of the country, where parents were self-isolating and hence people could not come to work. So there were changes made to the app recently where people were not being asked to self-isolate as much as they were before. And the final point is that this study that Dr. Mishra is talking about in India is also correlated with the study that was done in the UK just a few weeks ago, where the most important point was taken out that if you vaccinate the adults that are dealing with the children, especially in schools, then you will see the number of infections in children go down as well. And that's a really important point, because initially we thought it was the other way around. We thought that if children are not vaccinated, they're going to go to school, they're going to catch the infection, and they're going to give it to the adults, which was happening when a majority of the population was not vaccinated. But as the seropositivity rate in the populations increase, and as vaccination numbers in the adult population increases, you will see that the number of infections in the children will also go down. And that's what we're seeing in the UK at the moment.
Okay, that's a very important point that you make, Dr. Pushpak, and let me take this across then to our other two panelists. Anil Kumar, principal of DPS Faridabad, is with us. Anil Kumar, the suggestion that if teachers and support staff in schools are universally vaccinated, then that in itself is going to sort of bring down the possibility of COVID cases happening in children, and then the fear of those children then taking the disease home with them. Would you say, given